We're all familiar with ultrasounds and all the different applications of ultrasounds. And as part of our annual checkups as men, we're of course focused on the prostate and the risks of prostate cancer. And one of the challenges is that the ultrasounds are relatively low resolution compared to what practitioners really need to really diagnose the disease properly. And Randy, at Exact Imaging, you've created a technology that significantly enhances that resolution. What is the process by which you're able to do that?
Yeah, so we call it micro-ultrasound, and the concept behind micro-ultrasound is that it runs at a higher frequency. So if the typical way it's done for the prostate is around 7.5 megahertz, we run at 29 megahertz. That directly correlates to an improvement in resolution, and for us, that's 300% improvement in resolution to make that all happen for the urologist to be able to see what's happening inside the prostate.
And so if I'm a radiologist, urologist looking at the scans, doing the scans as the ultrasound technician, is there a different set of equipment that I have in the procedure, or how does that work?
So it's going to be a specific machine that we develop along with a specific ultrasound probe, ultrasound what they call transducer, and that's going to make all the difference in terms of getting that extra resolution. So a specialized system specifically designed to look at the prostate.
You've got a lot of IP around this, I'd imagine. Igen Partners has been an early investor and have followed you through a number of financings.
Yes.
What is the IP that you've developed?
We had to build brand new transducer technology, so that part that touches the patient, that was all very specialized construction because the conventional ultrasound machines are quite low resolution and they're made differently. So we had to invent how to make it get the higher frequency and also the signal path inside the actual ultrasound machine itself.
Now, one of the challenges today with the technology and the lower resolution images is there's a big workflow. That really trying to put a picture together is very complicated. How is the workflow today and how have you improved it?
Urologists traditionally always used ultrasound to guide their biopsies, but it was low resolution, meaning they had to do blind biopsies. So when they took their samples, they would just take a bunch of samples and hope they hit the cancer. What we've done is said, let's just fix that ultrasound machine, make it work exactly the same way so we don't have to involve other things that are more complex and take more time. So it's back to the simple workflow they've always had, but with the resolution to be able to see the cancer.
And have you been able to measure the improved outcomes yet?
So it depends on patient population. All these things always matter, what age of the men and all that sort of thing. But generally speaking, we'll see anywhere from a 50% improvement on relative improvement on cancer detection. Could be anywhere from 30 up to higher than that, 60 or 70%, but a definite improvement in the outcome.
A lot of men are worried about prostate cancer, but of course the population writ large is worried about every form of cancer. How can the technology help diagnose other forms of cancer?
It sees things in really great resolution, but you must be close to it. And so that's why the urology in particular is perfect for this technology. We won't be using it to look at mom's baby through the womb because the signal won't reach there. But if we can get close to it, it can tell the difference between suspicious areas and normal areas.
So from where we are today, what additional capital is needed to roll this out broadly commercially?
We believe we need about another 10 to 12 million Canadian dollars for us to reach that cash flow break even and then start to be self-sustaining.
But what's the capital cost for the machine that you've designed versus the current equipment?
It starts at around $125,000. However, if you're going to compare it, you should be comparing it to MRI ultrasound fusion, that more expensive, the tougher workflow to make it work, and we come in a little bit more value priced than that. So what we're replacing, we're actually a bargain for what we're replacing.
You've talked a lot about where the opportunities are to apply artificial intelligence to understanding these higher resolution images. What's the solution there?
Yeah, so the nice thing about the technology is there's so much resolution in the image that it really lends itself well to work for artificial intelligence to be able to tell what's normal and what's suspicious. So we believe we've had some success already, and we're going to bring to market next year, 2020, an actual program where the doctor will scan the prostate, they'll push a button, and it'll say, we think you should pay attention to the following areas. The machine sees suspicious areas, and the urologists are quite excited about that.